In this video, we're going to cover the structures associated with the neck. We're going to be able to visualize these on a CT scan. We'll look again in all orientations, so we'll see things in the axial orientation, the sagittal orientation, and the coronal orientation. So to start off and just to kind of go through the axial orientation initially, let me get to the superior aspect of my scan. The top of my scan, you can see actually some structures that you know. You can see the cranial structures here. As we continue to kind of go down into some of those structures that I want you to know, the first structure that I'm going to start off with is this structure over here. So what we're seeing here and visualizing here on the most superior aspect nearest to the ear, we can see the parotid glands. And like I talked about in the lecture, you can see how the parotid glands density or appearance, this grayscale, is darker in appearance than some of its surrounding muscles. So that should allow you to be able to say, all right, here is indeed the parotid gland. We can be able to outline that or contour that respectively kind of as we go through, and you can see as we transition what that parotid gland actually is looking like. So the patient has some dental fillings, and this is very common. So metal does, if it's too high of a density, it does create streaking artifacts, and that's what we're seeing there on this particular scan. But just to kind of highlight some of those other structures, since we're talking about salivary glands, I'm going to go through and emphasize where the submandibular gland is, and you can see that if you kind of follow my mouse there and there on both sides of the tongue respectively. We can be able to see that submandibular salivary gland there as well. So pretty well visualized. You can still kind of see it there and just kind of continue to track where that gland is. You can see that structure on both sides there respectively, right versus left. Additional structures to kind of note in the axial orientation, we'll look through the different structures here. You can start to see, of course, this is an airway, it's an opening. And as we continue to channel down and follow that opening, you should be able to see one particular structure coming in here. Really easy one to identify is the epiglottis. So you can see that kind of coming into visualization there in the screen respectively. Again, it's on the anterior side of the airway, and I think that's pretty well demonstrated here on that respectively. As we kind of think about, our locations, we can say, all right, we're in the laryngopharynx type of area in this regard. And as we continue to channel down, you can see, all right, here's some other structures. So here's the area that we classically refer to as the glottis right in here. So we can be able to see the vocal cords respectively. We can be able to see that the thyroid-based cartilage on the anterior side, and on the posterior side here, we can be able to see the cricoid cartilage there. We can even actually be able to see some of the tracheal cartilage, that's those C-base rings, kind of as we continue to go down or more inferior into our slices. So looking back up though, I want you to notice here's the trachea and here's the esophagus. So as I continue to go back up and more superior, you can see that they are essentially combined as one, but then as we continue to kind of morph down, you can see that division, that separation in between airway and the esophagus respectively. So you can definitely clearly see, all right, here is the esophagus, here's the trachea. And on as far as accountability goes, I'll give you, a slice to be able to identify those that I think is going to be well demonstrated, like what we're seeing here. Very clear division between trachea and esophagus, and continuing to go to more and more inferior. You can see it's a little bit more difficult to identify the esophagus than you might think, just because if it's not air filled in any way, it somewhat blends in with the surrounding tissue, the surrounding muscles. So again, you can see here is trachea, here's esophagus. I'm just going to kind of leave my mouse, the pointer, all over the esophagus, and you can kind of see a little bit of air housed right in there. But kind of continuing to go down, you can see that those structures are indeed in different locations than one might think. So it's kind of continuing to go back up now. Let's reiterate some of those other structures that I want you to know. And one of those structures that I want you to know is definitely the thyroid gland. So you can see that structure here kind of wrapped around the trachea. And you can see it does appear to be a little bit what I consider a glandular-like appearance, like a tapioca or a cottage cheese type of appearance. You can start to see that there, and you can see it's gone. So it's not on a ton of slices, but nonetheless you can effectively be able to visualize that as we kind of go through. looking at it just down in this orientation, the sagittal orientation, you can see it pretty clearly here. So as we continue to kind of pan back through, all right, we should be able to see it then there respectively as we kind of go through the scan. So as we're going through it, hopefully you're being able to visualize where it's going through on those given slices based on what we have up currently. So whether that's the scaled image, the sagittal image, the coronal image, or the axial images. Additional structures to kind of highlight. I believe we talked about the glottis. Hopefully we've talked about the vocal cords that then surround that. So here's the area of the glottis. Here's the true vocal cords on both sides of that area. Other structures, you can see here is the area epiglottic fold right in there, and then subsequently we have the piriform sinus. They're pretty well visualized here, and then you can see subsequently where we're at then on the sagittal image there additionally. And obviously we can see where the epiglottis is pretty clear on this particular image, but then see how that correlates based on where we're actually at. Okay, we should be not visualizing the epiglottis anymore. In essence, we're not. We can see it very, very clearly here, 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 and that correlates respectively on the sagittal-based images. So hopefully you're seeing these transitional phases that are kind of going on as we kind of go through the scan itself. So what I want to do is just to go over the vessels as well, and I'm going to start kind of inferior and work my way superior. That way you can see these points of bifurcation or these points of division. So respectively, you can see the internal jugular vein here, and we can see the common carotid artery here. So right common carotid respectively, left common carotid respectively, and subsequently, internal and the internal jugular vein on the right and internal jugular vein on the left. So as we go up more and more superior, you can see that they're still connected, or there's still one solid vein or artery until we start to see some transitioning points, and we'll start to see them relatively soon. You can see there's a bifurcation here, so the jugular is bifurcating there. And then you also can see that bifurcation taking place now in the carotids. So when we look at that, you can be able to say, all right, now I know that this is the internal carotid versus this is the external carotid, just based on those proximities. And as we continue to kind of follow it up, I want you to follow the external one, and you'll see, all right, why is it named what it's named? When it's more, medially located, it's really more internally located than the internal carotid. But as we continue to kind of follow that vessel up, you'll see it eventually diverts out, and it gets smaller and smaller and smaller, but it's eventually diverting out and becoming more and more external as we continue to kind of follow it up. And then respectively, if we go back down and follow the internal, see what the internal does, point, 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 you can see respectively what's going on there as it continues to channel up more superior. And it is, yeah, indeed, here's the internal now, here's the external, so you can see those divisions. So, a common slice for identification may look, something like this, where you're identifying the vein, you're identifying the carotids, and seeing which is which, respectively there. So in essence, those are the key structures that I really want you to know, but I will spend a little bit of time now going through the different orientations just so you can say, all right, I kind of get this. So on the sagittal image, and let me go back down a little bit more inferior so you get that visualization. So where we're at, here's the epiglottis respectively. As we kind of continue to go through and channel through, you can see that a lot of the structures that we're referring to are midline structures. So when we look at those structures, then you can see, well, for instance, the hyoid bone, we can see the mandible, we can see the tongue, we can see the airways respectively. So we can see the oropharynx, or the, rather than uvula. Let's see if we can see the nasopharynx. You don't really see the nasopharynx in a true division, but here would be the area of the nasopharynx. Here would be the area of the oropharynx. Here would be the area of the laryngopharynx. And then as we transition down into the structures of the larynx, you can see here is the trachea versus here is the esophagus. And the esophagus, again, is always going to be posterior to that trachea. On this particular patient, you know, it's going to take on different appearances, but at least on the superior aspect, you can see that relationship is maintained. So the anterior position versus the posterior position. And kind of as we go through, you know, you can see, let's see a structure that I hadn't really pointed out. The vallecula on the anterior aspect of the epiglottis is demonstrated there, so we can be able to see that. We can be able to see, I've talked about the thyroid gland itself, but we can be able to visualize that somewhat well on these respective slices. So to kind of move on and to look at it then in the coronal orientation, you can see, let's go anterior, so you can see the face there, so you can kind of get your baseline where we're at. You can utilize these lines here to give you that baseline as well. But as we continue to go more posterior to look at some of these neck-based structures, you can see some things that we've talked about. You can see the parotid gland there, and then you can see the ipsilateral, or contralateral rather, parotid gland over here on the right side, so right parotid versus left parotid. You can see the structures of the mandible, which you've learned and should know at this point. But you can see then, all right, what does the epiglottis really look like? We can be able to see where the epiglottis is. We can be able to see very clearly where the piriform sinus is. We can see that airy epiglottic fold going more vertical there and there. Respectively, then we also can see some of that vasculature. So we can be able to visualize then, all right, here is the internal jugular vein. Over here, it's very thick. And in comparison, here is the common carotid artery. And you can see that where that's at on the patient left here versus what it looks like, for instance, on patient right. So you can see that common carotid here, and then you can see the jugular there respectively. So a lot of cool structures to be able to visualize. I think neck anatomy is a little bit more difficult to visualize than spine anatomy, for example. But nonetheless, you know, you're seeing those similar types of structures that you have learned now and should know now. So you can see that where that hyoid bone is. And we know that as that transitions down, then you'll be able to see the cartilage of the larynx, so that thyroid cartilage versus that cricoid cartilage there respectively. We can see then subsequently, you know, where the thyroid gland is, and where the trachea is, and where the esophagus is. So a lot of really cool structures. So hopefully this video helps cement some of these concepts, and you can now be able to visualize them a little bit better than you had been able to previously. Thanks a lot.